Good afternoon, everyone. Today we will be working on healthcare demo setup. To begin, we'll select the healthcare module and then go to health patients, and then we'll create a new patient. We'll edit the full form. Here we will fill out the details of the patient as per the requirement. Here, customer details and patient details can also be filled. Then we'll go to medical and history tab. Here, all the medical history can be recorded of the patient. We just select all the details as per the requirement allergies. All the details can be filled here. These all are not required in this demo right now, so we won't be filling them. And all these tables can also be filled right here as per the requirement, and then it can be saved. Now, more tabs have appeared, so we can go on all of them to view. This shows all the connections that can be created. Here we can add emergency contacts, which is really important. Country code also needs to be selected here before adding a number. And documents can also be attached, and attachments can be added here as per the requirements. And here attendees can also be added. Now all these details which are filled can also be saved. Now this patient has become active. Now we'll begin the procedure of admitting the patient. That can be done from inpatient record. We'll just click on the plus sign. Now these all are interlinked, so when we clicked on the plus sign, all the details have been fetched, and admission type can be selected, which can be voluntary or involuntary. Both the flows are the same. Admission date time can be selected here. Medical department which he has to visit. We will select physiotherapy. Service unit which he requires. Expected length of stay, let's assume 2 days. Healthcare practitioner which is practicing physiotherapy and will treat our patient. And there are two. We can select any one of them. Attendees have been brought forward from the previous filled data. We can just save this. And to confirm his admission, we need to click on here on admit and select the service unit. And no service unit has been selected. So this has admitted our patient in our hospital. When the admission process is beginning, there are four documents which are created. It is intake report, risk assessment, registration form, and admission checklist. Now these are all the connections that would be made from end to end. So we'll just duplicate this and proceed with our flow on the another tab. We'll submit all of these one by one. So we'll begin. Here, intake report can all be filled out, and things can be attached as per the requirements, like all the basic details, and then these can be saved for further data recording in our system. This has been submitted. Now we'll submit the risk assessment. These are the forms for risk assessment that will help us to determine the risk level. We'll just fill out few of these. These are not mandatory to be filled out for our flow, so we'll just fill some of it and then skip the rest. All of this declarations and all of these terms and conditions and liabilities all are mentioned in this registration form here, which the customer needs to accept. Details can be filled. We'll just save it out and then we'll submit it. And this has been submitted. And the last one that is left is admission checklist. We'll just complete all of this out. All of this checklist needs to be completed for the patient admission in this hospital. We'll select here healthcare practitioner. It was Mr. Anshul, so we have selected that. Remarks can also be added here. All the date and time have been recorded in these fields right here. So we'll just save it and we will submit it. This all needs to be filled out, but as to as for our flow, we won't be filling them. Now all this details have been filled, so we need to proceed with the MDT notes. This is the important thing right here. We'll just click on plus and select our create a new patient appointment. We'll need to first select the patient, and then we'll have to check for availability before getting a appointment with Dr. Anshul. As per our settings, Dr. Anshul only comes on Sundays, so we'll have to arrange for his appointment. They'll let us select it for 11. And we'll book the appointment, and appointment has been booked automatically. Notes can be entered here. Symptoms can be also added here. Let us say bloatedness is being felt, XYZ. Now here medical codings can also be added as per the requirement. These are, these can all be filled. So we'll proceed with medications. Any medications that are given can be added here. Let's assume medication 2 is being given. Drug code is automatically fetched. Dosage patterns can be seen here. They can be, and these are pre-created, so we can select them. 2 days, and dosage form that we can select what type of dose it is. We'll select tablet, and then 3 tablets a day for 2 days equals to quantity 6. Then we'll click on clinical procedures if any of them had to be done for the patient. Then here we can add the referring practitioner also, who has referred the patient to perform this procedure and on what date has he aligned him with. And then we'll click on therapy. We can also add these. Number of sessions, 1. We had skipped this, so we'll be filling these out too. Lab tests, chest x-rays, moments. All this have been filled out as per the requirement, so we'll just save our MDT notes and we'll submit them. After we submit it, all the four fields have been also auto-created right here. These are patient medical record, pharmacy task, medication requirement, and service requirement. These all have been created from the information we have filled in the tables or the information we have filled. So first we'll be going to patient medical records, and then we'll verifying these records which have been created here, and we can also attach this medical records as per the requirement and just save the information right here. And then we'll be getting the vital signs of the patient, so we'll be just be clicking on this plus, and then we'll record all this will be recorded. All the basic details can be filled. Height can also be filled according to the requirement, height and weight. That will also show us if he's underweight or overweight. This shows us that it's underweight, so we'll just save it. And once it is submitted, it will auto-create a nursing task for it. Now we'll go to service request, and here all the services have been created which were created before. So it will lead to first we'll check the which one has to be done. So we'll go with the chest X-ray first. Then to create a chest X-ray, we need to create the lab test. So we'll go on plus lab test, and then test template needs to be selected. Chest X-ray when it is to be done. All this information can be filled right here: comments, results, medical codings, and all this information. We can also get this from patient encounter. We'll just submit it and it will be done. Now, as our lab test has been completed successfully, we'll need to go back. Here it shows completed. Now we'll go on physiotherapy, and then we'll create a therapy session for a physiotherapy session. We'll select the therapy plan and first go, and we'll go and select art therapy. All the details have to be filled, like exercise type also needs to be filled, that needs to be created. So we also need to select the appointment. We of course need to reschedule the appointment. And so we'll be booking this appointment. Therapy plan needs to be selected again. Therapy type. just save this out now and then submit it. Now the therapy session has been created and submitted. Now this has been closed and completed. I'll go back. Now these two have been completed. Now we'll proceed with the third. This integrated clinical procedure. Appointment can be selected as per the requirement, and this is therapy session. All this can be done. All this can be filled according to the needs, and then we will save it. We can also get all the details by clicking here from patient encounter, and then we'll fill it out. Then after all the details have been saved, we'll just click on start, and then after clicking on start, it will select to in progress, and then we can complete it out. And then it has been completed, and the status has also been set to completed. Now we will go on to complete the pharmacy task and medication request. So we will check if our medication is in the pharmacy or not. So we can just select out here quantity issued or 6, and if it has medication then any marks as per the requirements. Then we'll just give it out and then we'll submit it. After a pharmacy task has been created, nursing task is also auto created, and that will need to be filled out and submitted and started. That will change it to in progress and then it will be completed. First, we will fill out the task document and then it will completed. And it has been completed now. Nursing task has also been completed and pharmacy task has also been completed. So now we will complete the medication request. All the details can be checked and it can be done. And if all everything is done, we'll set the status of this to completed, update the status, and completed medication request status. All of these details have been completed and done. So now our treatment has been completed. Now the only thing left to do is to schedule the discharge and ask for payment from the customer. And then we'll click on schedule discharge. Who is discharging the practitioner? Discharging practitioner, nurse, follow-up date if any. Instructions and some notes can be added here. Now when we click on discharge, then discharge summary and discharge checklist has been created. We'll first complete the discharge checklist. All this can be filled out. First we'll check the healthcare practitioner, then we'll click on all this checklist needs to be checked and completed. Then we'll save it and submit it. And then discharge summary can be filled out. Here we can fill out all the data as per the requirement for it to stay in our records. Follow-up recommendation, treatment advice, condition and discharge, all this can be filled. And what medicine are we discharging it with and what dose is he required to take from that medicine. That can also be filled out here. And then just save it out and then we'll submit it. Now this has also been submitted. Now the thing to create is sales invoice. We go to patient. We go to patient and issue a sales invoice. Here is our patient. We'll go to dashboard and then we'll click on sales invoice here in billing under billing and payments. All the details will be fetched and we'll select the items that have been used. Chest x-ray was done. Medicines were provided. Let's assume this medicine was provided and an art therapy was also provided to him from our side. So we will just select it. All the rates that have been pre-selected will be fetched out here, and taxes can also be set up according to our need that are done here. We'll just save it. HSN code is required. That will be done. We'll just select the one that has the HSN code and just paste it everywhere. Now, after the sales invoice has been submitted by us, it will go for checking first that if the invoice has been created, that is good or not. Then we'll, after the checking has been done, then we will submit it. Now it shows the status of being unpaid. For that, we'll create a payment entry to receive the money. Mode of payment can be selected as any of them. All the details will be prefetched from previous slides. And then we can just save it and then submit it. Now, as we can see, payment has also been done and sales invoice has also been created now. Now we can just click on the discharge and the patient will be discharged. Now he is discharged as shown here. Thank you.